You know, the TALAPRO study is the third study kind of in this space with an AR pathway inhibitor and a PARP inhibitor. I would say that actually the data looks at least as good as all the other studies, but the deficiencies in terms of what patients received outside the trial, I think, are significant. There are a couple other trials maybe to note. One is a quite small study, the BRCAAWay, that is evaluating combination versus sequential monotherapy very specifically, but there's only about 20 patients per arm. There's another study that's a cooperative group-sponsored study called CASPAR, which is looking at enzalutamide plus or minus Rucaparib. Very similar design, very similar setting. That trial is on hold right now due to some sort of business and financing issues, and we're hopeful that that will get started again. Though it's kind of a latecomer compared to the other three studies in this space, I think it could do could be very informative in terms of really knowing if that combination is worthwhile for our patients, because I'm expecting that a lot more patients will be exposed to a PARP inhibitor off trial should they progress and not have received the Rucaparib within the context of the trial. I think other questions, you know, in a setting where that's more financially limited or maybe less access to PARP inhibitors, what about Carboplatin? Is that as effective as PARP inhibitors? We don't know the answer to that. There actually is a trial going on in the VA setting that's trying to answer that question. And also, you know, could Carboplatin still be effective after progression on PARP inhibitors? We don't really know that much about cross-resistance. There's a little bit of data from earlier PARP inhibitor trials, but I think that also remains an unanswered question.